Hi, I'm Sara Newman, Occupational Health Coordinator here at the Dallas Opera. I also happen to be a certified speech-language pathologist or a professional who diagnoses and treats cognitive communication and swallowing disorders, much like Sandrine in the show. We're so excited to give you an inside perspective on the diving bell and the butterfly, locked-in syndrome, and how communication and movement are affected. Let's start out by talking about the communication in the show. What you're seeing is called augmentative and alternative communication, or AAC. Jean Doe uses a technique called partner-assisted scanning, where he and whoever is communicating with him have a two-sided letterboard featuring the alphabet that's ordered by frequency of the French language, so ESARIN and onwards. Whenever Jean Doe wants to select a letter, he will blink. Now, what you may not know is that communication systems like this are utilized by people around the world, and they can be low-tech, like a letterboard, or they can be as high-tech as something that has an eye gaze scanning system. So with regards to the movement in the show, I want to introduce you to somebody. This is Traci Betts, our medical movement consultant and physical therapist. Traci, can you talk a little bit about what somebody with locked-in syndrome might look like?
Oh, absolutely. Locked-in syndrome is devastating from a movement perspective because what happens is the connection between the brain and the muscles are impaired. So despite someone making decisions to move, their body does not respond.
So in the show, at the end of Act 1, we see Lucas Meacham, who plays Jean Doe, strapped into what he refers to this as a therapy table. Can you talk a little bit more about this and how it's used in therapy for locked-in syndrome?
Absolutely. So a therapy table, or also known as a tilt table, is designed to help someone who could not otherwise stand be in an upright position. See, our bodies love to be vertical. Our heart, our lungs, our muscles, our bones, and our skin respond well to being upright. And we have to find a way to help people who cannot otherwise stand be vertical.
And so, Traci, we're so grateful for your expertise on this show. I know I mentioned that you are our medical movement consultant. And one reason that we brought you in is because we really wanted to make the movement authentic. Can you talk about your role as the medical movement consultant on Diving Bell and Butterfly?
Absolutely. This has been one of the most fun opportunities for me to consult. So the Dallas Opera wanted to both keep their performers safe as well as maintain authenticity, like you mentioned. So for the performers that are doing lifting and transferring of someone who's physically unable to help, we had the opportunity to practice that safely and learn how to do that in a way that would replicate how healthcare workers are going to transfer patients. And then the rest of the company and Lucas Meacham were so intent on maintaining authenticity and respect for patients that have something like locked-in syndrome. And so we spent our time on the details. You know, how is head control looking? What is it like to sit in a wheelchair whenever you don't have movement? And how does joint integrity change over time? And the company was just fantastic in capturing those details and carrying it through the whole production.
And so many of our audience members are meeting a character or anyone with locked-in syndrome for the very first time. And so with somebody who has so much experience in this area and working with neurological patients, can you talk about, or maybe tell us something that, about locked-in syndrome that our audience might not know, or what somebody with locked-in syndrome might want others to know?
So with locked-in syndrome, as you mentioned earlier, someone's cognition is there. It's their body that cannot move. And I think the key is to remember that anyone with locked-in syndrome or any other physical or mental disability is still a human and is still someone and is still deserves the respect and honor and dignity that we would grant for anyone.
Yeah, absolutely. And I think that's why we see that these types of communication systems are so powerful to give people who may have lost their voice due to a condition like locked-in syndrome that ability to communicate back. So we're so grateful for the speech-language pathology, the physical therapy, as well as the occupational and other associated therapies out there who work with patients with locked-in syndrome and anyone in the world who might need a little bit of help getting themselves, what am I trying to say? Traci, you fill in the blank.
Going that next step in their healthcare recovery.
Yeah, absolutely. This opera has really inspired us to think deeply about how we can promote accessibility in the arts and in opera specifically. We're so grateful to everyone who had a hand in bringing this show to the stage. And without further ado, here's Act 2 of The Diving Bell and the Butterfly.